Marriott from Boston Desi Connection TV. Today we are at the New England Health and Wellness Expo at the Burlington Marriott. We'll be talking to the organizers as well as some of the speakers today, so stay tuned. We have with us Upendra Mishra, the founder of India New England and the organizer of this Wellness Expo. First of all, I would like to congratulate you, Upendra ji, for organizing this amazing event for the benefit of our society.
Thank you very much.
It's just an amazing experience for us. How many years have you been doing this now?
This is our third year. The first year we had about 1,000 people came. The second year, last year, we did in this place, the Burlington Marriott, we had about 1,500 people. This year, we expect more than 1,500 people. And this year, we have about close to 50 speakers who will be talking about virtually every aspect of health.
That's just amazing. And we're here from BDC TV. The first question that comes to mind is, what prompted you to start these expos?
I'm a physician myself. I was the president of the Indian Medical Association of New England in 2013. And I also worked with a lot of communities and our community, especially at organizations. So when I was the president in 2013, this was my dream, to have an event which was so big that the entire community would benefit from. I also worked with the Indian News. So we started the process. We did the first one in 2013. It was very successful. We did another one in 2014, and now we are doing our biggest expo. So I'm very excited about that, and what I like also is the way the community has supported us. So, the community education is very important to all of us.
We do appreciate it a lot. Yes. So as a doctor yourself, what do you think is the biggest challenge that people of South Asian community are facing health-wise?
Health-wise, I think one of the things we do face is we tend to be a little bit inactive. I personally in this winter, I didn't do as much as I should. So we need to be more active. I think we have to keep moving. Even if you are not exercising, don't sit in one place, keep moving all the time. And our experts say that, and I certainly will.
And do you think Indian food impacts our health a lot?
Yes, I think because if we cook in the traditional way, then of course we're putting a lot of oil and spices. I myself love spicy food, so I think you have to make a good balance. You keep the taste, but you cut out the unnecessary fat.
So do you plan on adding more food-related topics to the expo?
Yes, and this year actually we made a video with food experts also, which you can check it out. But yes, nutrition is, we know so much about Indian food, but we don't know the nutrition value of Indian food. So that is what we aim to teach.
That is awesome. Thank you so much for talking to us.
So we have a special Ask the Doctor section, which is very popular. You can ask our doctors any problem you have, and you're going to get a quick response. We have been doing this for past few years, and the response has been very good. We mutually benefit from each other. I think organizations have to collaborate this to reach and help maximum people. So we're thrilled that we are part of this, and we would like to continue this.
This event, I think, is a wonderful program that introduces people to all different styles of medicine and health and wellness, not just Western modalities, but Eastern modalities and preventative medicine as well as curative medicine. And I think it's such a great opportunity to see a lot of people and to help a lot of people.
Hi, I'm Sapna Agarwal. I'm the president-elect of IMAD. I'm an internist and I've been associated with Health Expo since we started 3 years ago. I have been moderator and co-moderator in many occasions. This time I'm doing moderating of health and nutrition segment, where we would be asking the speakers very interesting questions, and as part of IMAD we're doing free health screenings where we are doing blood sugars, blood pressures and all.
How did you start this Health Expo? How did you come up with it?
Well, the reason is that, as we Indians, South Asians, we don't take much care of our health. And as I started to read about health awareness among the South Asian community, and we found that we don't take anything like heart or diabetes or food or exercise seriously. So we decided to educate our community about health issues, that how we can prevent it first, and then how we can live a better life and healthy life.
Hi, I am Dr. Shalini Manshramani with me, a practicing psychiatrist. Thanks, Dr. Shalini, for talking to me.
Thank you.
The first thing that comes to mind is, what are the symptoms of depression? You know, I'm sure it's different in different people, but what is it that we should look for?
So one of the things, the reasons why I wanted to outreach today was to encourage people to be aware of their symptoms, and if they or their loved ones are experiencing any of these symptoms, that they should reach out to a mental health professional, talk about it, see if they need medications or therapy or both. So some of the symptoms, the typical symptoms of depression are you need to have at least 5 out of the symptoms that I'm going to talk about, and you need to have sad mood and a sense of lack of pleasure in almost all activities on a daily basis, kind of a thing. And then people can have reduced need for sleep or excessive sleep sometimes, reduced appetite with weight loss, trouble with focus, being able to concentrate for a long period of time, excessive feelings of worthlessness or guilt. People can also have lack of energy, and then suicidal thoughts. So if people have multiple of those symptoms, they should contact a mental health provider.
Okay, so as a community very deeply impacted by Bollywood, you might have heard that Deepika Padukone came out recently revealing her depression. What do you think about that? I mean,
I'm very glad that people are coming out in the open and being honest and talking about their symptoms and their illnesses, because I think it encourages other people to not kind of like be stigmatized or think that it's in their head. I consider, and you know, all of medical community considers depression as par with diabetes or high blood pressure. It is an illness just like diabetes. People need to be aware, people need to take care of themselves.
Thank you. So as Dr. Shalini said, mental illness is just like any other illness. It's something that we should come out with and reach out to a professional for help. Thank you so much, Dr. Shalini, for talking to
You're
us.
very, very
Thank you. Hi, today I have Pratibha Shah, the founder and director of Holistic Health Alliance and Ayurveda. Thanks, Pratibha, for talking to us. The first thing that comes to my mind is, how do you think alternate medicine can benefit the population in general?
Absolutely, and that is one of the bigger questions in healthcare today, because what the government is seeing is that there's a lot of interest in alternate medicine and alternate ways of getting well, but still there is this barrier of not covering it under the insurance. So the demand is there, people do want alternate options of getting well, and I think we are not being able to match up and provide coverage for this demand, but there's a lot of scope.
So what do you think are the biggest obstacles? You know, Ayurveda is an ancient art, but still there are many obstacles. So what do you think are the biggest ones reaching out to the general population?
I think in US, as far as Ayurveda is concerned, one of the biggest challenges is awareness. But beyond awareness, I think it is the big money factor, because people have to pay out of pocket, and that prevents and that it brings down the access to such a rich body of wisdom and solutions, which are really, really helpful, because I've been practicing this for more than 25 years, and I can vouch for how beautifully Ayurveda brings out the healer within us and supports the systems to allow natural ways of healing. So, this is a very powerful non-pharmaceutical way of getting well, and if you're deceased, getting well, but also about prevention. Ayurveda is so much about primary prevention. There is so many protocols and ways of daily living and self-care that first of all prevent disease, which is very important. So it's
it's a powerful science, ancient science, but there are some challenges as far as practicing and reaching out to this community.
So what are you doing to make sure that you reach out to more people and bring awareness in the community?
I am actually very passionate about Ayurveda. I'm a self-appointed ambassador of Ayurveda, so to say, and I really, that's why I enjoy my job so much, because I'm so passionate about it. So what I have done recently is that I have founded a non-profit which is called Holistic Health Alliance, and I'm trying to get all holistic modalities together under one umbrella body. And the idea is to foster cross-holistic modality collaborations and also increase visibility to our communities so that they don't have to worry about, where can I find a homeopath or where can I find a Reiki practitioner. So, support them, and we've been doing a lot of free talks in the community. The whole idea is to educate, empower and engage our community to be healthier. So I think we have done a wonderful start, and we are looking forward very excitedly to forge all these collaborations and to try and see how we can integrate with the mainstream healthcare so that there is more increased access and awareness to alternate ways of getting help.
Awesome. So as they say, prevention is better than cure, and that's what Pratibha said to us again. Thank you so much for talking to us.
Excellent. Pleasure.
Hi, I have with me Dr. Naresh Manshramani, a pulmonary specialist. He is going to be talking about smoking cessation, asthma and lung cancer. Dr. Naresh, smoking is such a big issue. My father was a smoker throughout his life, and he managed to quit with a lot of difficulty. I've seen him struggle, so my biggest question is, what are the different ways of quitting, and what do you recommend? Obviously, it's bad for health.
So, we've been, I deal with pulmonary diseases, and pulmonary problems are just one set of problems that you deal with cigarette smoking. You have atherosclerosis, early heart disease, cancers, not only in the lungs, but in the stomach, the urinary bladder, and everywhere else. So you increase your, risk of death. You double it up by smoking. So overall, worldwide, it's felt that preventable causes of death, smoking is one of the most preventable causes of death. But nicotine addiction is tough, and it is very difficult to get off nicotine. There have been studies done, and nicotine is considered none less than some of the other hard drugs. For example, cocaine, when you have to quit. So what I do is, when I work with my patients, we make a quitting plan. So number one, when I tell them, you've come to see me because you have a problem, medical problem, or whatever you're dealing with, so you've already made up your mind, I hope, that you're going to quit now, if you're dealing with lung cancer, for example. So the first thing to decide is to make up your mind, all right, whatever the circumstances are, you have to quit smoking. Number two, I tell them to identify. I say, where do you smoke the most, all right? If you smoke in your car, you're going to work, but you got to identify that spot and tomorrow make the decision that I'm not going to smoke the place where I smoke the most. Number three, I'm going to keep something with me, all right? You're going to, for the first 4 days, when you quit smoking, you have an intense urge, all right? You have craving, you get anxious, you're going to fight with your spouse, you're not going to be able to sleep, so you're going to be irritable. So we have to deal with all these things. So I tell them, you keep a gum, take some exercise, do something that will get your mind off the cigarettes at that point in time. And number four is to make sure that you identify your friends and family, all right, that you're going to be talking to. Because you're going to need to do a little counseling. Just talking to people will help. And number five is medications, where our help comes in. And we tell you how to quit. There are nicotine replacement treatments, there are medications. One of them is called bupropion, the other one is called Chantix. So there are medications that we will prescribe. They're over-the-counter medications, and we can help you quit. So the goal is, decrease the risk of the diseases you're going to deal with, and hopefully improve your lifespan.
So what's your recommendation for parents to help their kids not get into this addiction?
So, I think what we're seeing is, there's a big article this week on cigarette smoking in middle school and high school children. And what they're identifying is that, there's a changeover to e-cigarettes. E-cigarettes came out as a nicotine replacement treatment for smoking cessation, but the companies have been promoting it and they're using it for high school children and middle school children. So I think just, making sure that you keep counseling your children, keeping in, close touch with them, make sure that they're not getting into some, addiction problems is very important. And a lot of times it's peer pressure. So you got to make sure you identify keeping good company for them, and parents, relatives not smoking, because they see an elder person smoking in the house and they feel probably it's not that bad because they're doing it, how come we can't do it?
Okay, thank you so much. Thank
All
you
right.
for talking to us.
Thank you very much.
Hi, I have Anu Chitrapu with me. She's the director of the workshops at the Wellness Expo. Hi, Anu.
Hi.
So the first question I have is, what's been your experience in organizing all these wonderful workshops here?
Yeah, first of all, I have to say, the response has been great. Ever since we started organizing the workshops, we've been overwhelmed with requests from people who want to participate in the workshops, not just as speakers and people offering the workshops, but also people saying, we have suggestions, can you include this, can you include this? So as a result, you'll find this year, it is a very tight schedule, literally packed from 9 to 5, and people are here at 9 o'clock. So that's what I would say, is like the demand seems to be very high for this. So it's always a challenge to accommodate everyone without turning everyone away. So we've given short slots, but we have managed to squeeze in a lot in this time.
Okay, so the format of this event is we have some medical talks going on and then there are the workshops, and we're
Yeah.
almost midway
Yeah.
the event. What's been the response, and what's the difference first of all between these two things, and so far what do you see is the response in general today?
Okay, so I'll take the first part of your question, which is what is the difference between the talks, the medical talks that are going on, and the workshops. So the medical talks are all by medical professionals, and that is going on in this room. So we started out this morning with Dr. Anju Noria on cardiology, and the best of the best, the experts in the medical field are in that room giving advice to people. The workshops are slightly different in that the workshops is not where you just sit back and listen, but you actually do physical stuff. So we started off with yoga, right? And people are learning yoga. You have to, get down on the yoga mats, do the yoga. There was a very good meditation session this morning. So people actually did meditation. Geeta did her power yoga. So the workshops are more like come and learn how to do and do it. And to answer the second part of your question, how has the response been so far? Well, the response has been phenomenal. What I'm finding is, I really thought at 9 o'clock in the morning when the yoga sessions were starting, I looked around and I said, well, there are not many people. I wonder if the room will fill up. By 9:05, everyone was here, and in fact, what I'm finding is that people are saying, they want more room because especially in the yoga and meditation sessions, we could not even accommodate so many people. There were so many people who wanted to do it. So that's one part of the feedback that I'm going to take back to Upendra. The other thing is, because we have so many sessions, the sessions are all like 20 minutes or 30 minutes in length. Several people actually came and spoke to me and said, we actually want more, so can you extend each session and have at least 45 minutes to an hour, because the topics are all so interesting and we really want to hear more. So far that's the response I'm finding. But you walk into any of these rooms and you'll find that the rooms are full.
Sounds like it could be a two-day affair.
I know, yep.
Awesome, awesome. Thank you so much for organizing this, and thank you for talking to us.
Okay, great, thank you.
Hi, I have Dr. Anju Noria with me. She's a staff cardiologist at Brigham and Women's. Thank you, Dr. Anju, for talking to us.
Thank you.
What's the biggest issue you see in the South Asian community with respect to heart disease, the occurrence of heart disease?
So I think the biggest issue for South Asians are that, number one, we have a very high incidence of the metabolic syndrome and diabetes, and that is the biggest cause of heart disease among South Asians. And I think the other thing that we have to realize as a community is that
we have heart disease at a much younger age than the Caucasian population, and therefore just because we're in our 40s or in our 50s, we shouldn't ignore the symptoms that might be telling us that we have heart disease. And really the basic cause for us having the metabolic syndrome and diabetes is obesity and lack of exercise. And the obesity is in large part related to our diet.
So you already said a little bit, but my next question is what can we do to reduce the risk? It's, as you said, it's very high in the South Asian population.
So I think the biggest thing is, A, being aware that this is a problem for us as a community, and I think number 2, adjusting our diet to try and include more fresh fruits and vegetables, eat less fried food, eat less trans fats that tend to be very high in our food. I think physical exercise, doing at least 30 to 45 minutes of physical exercise 5 days a week is a big important thing that we can do. And then I think thirdly is, being aware that the traditional targets for cholesterol, body weight, waist circumference may not be what is required for the South Asian community. We have lower targets because of our increased risk. And so just being aware of those targets and bringing them to the attention of your physicians. And lastly, I think, the thing to do would be to try and kind of be aware of your symptoms and not ignore them and come to medical attention if you should be.
So there's been a lot more awareness about exercising in the last 5 years. Do you think that the occurrence of heart disease has decreased over the last 5 years?
Not according to the statistics. Unfortunately, the occurrence, if anything, is going up, not down. But I think that's because with the Western lifestyle, a lot of us are actually becoming more physically inactive rather than becoming more physically active. And I think the study that requires to be done is if you compare South Asians who do exercise vigorously versus those who don't, is there a difference? And then that would be more motivating for the population to try and change their lifestyle.
Do you think there is a difference between the occurrences in the United States versus in India?
So in India, heart disease is the largest cause of death for both men and women, and as I mentioned in my talk earlier today, about 40% of all heart attacks in India happen below the age of 45, which is quite different than the statistics in the Western world. Unfortunately, even in the Indian diaspora, and whether it's in Canada, India, the UK, Singapore, we tend to have the highest proportion of heart attacks relative to other ethnic minorities. So it may not be the equivalent rate as India, but we're still the highest amongst everybody else living in the Western world.
It is very sad. Heart disease runs in my family, and my father had a major heart attack, and he underwent a bypass surgery, and then he had a stroke, and he's been paralyzed for the last 3 years. So who but someone like me feels that, it runs so strongly in my family that I have to be extra cautious about what I eat. And I want to make sure my kids see that. I lead that by example, make sure you eat fresh fruits and everything. So I listened to a little bit of your talk, and I think that was very, very good. I hope that the message reaches out to people, and I hope that we as a South Asian community follow some of the basic principles, and in the next 5 years at least see the occurrence go down.
Thank you so much.
Thank you so much for talking
really
to us.
much.
Thank you.
That's what I did.
So as you just said, this has been growing every year. What are your plans to take it to the next level?
Well, the next level already we are starting to think that we want to expand this health expo. So far it has been confined only to the Indian and South Asian community. Next year, ideally we would like to get everybody involved in this. Again, the main theme could be related with alternative medicine and the modern medicine. But we would also like to expose this alternative medicine part of this to non-South Asian audience here. So next year we are going to try to outreach non-South Asian communities.
So this will be much
That will be at a much bigger scale and a larger scale. And I think we have the infrastructure, we have the outreach, and I think we can do that.
Yeah, we've been going around listening to sessions, and this is just an amazing experience. We keep talking about these things. Health is the primary concern, health is wealth. And thank you so much for doing this for the community. We all appreciate it. And thanks for talking to me.
Sure, you are welcome, man.